You know, there's no way as a pre-frosh coming in I could possibly have imagined what it was gonna be.
Definitely that pressure of kind of proving myself.
It felt like I would likely get a little lost.
You get your first exam back and maybe you get a C, and this is the first C you've ever gotten in your entire life. It's like, whoa.
And you think you are the only kid that the admissions office made a mistake on.
Students look around them and see other students who appear to be thriving and don't know that not everyone who looks like they're thriving necessarily is.
And I think that the outside world says that, you know, you get into a school like Yale, you have it made.
And I think sometimes people really work hard to keep up this facade of perfection.
You know, students are thrown into an environment that's challenging for them academically, that's challenging for them emotionally, that's challenging for them socially, and it's challenging for different students in different ways.
Some anxieties about, you know, leaving your hometown.
What I want every student to know about mental health and counseling is that we're here to help. That's really our purpose for being here.
Trying to get adjusted.
We're here for the ordinary crises.
So how many suite mates do you have?
And we're here to treat people who have ongoing, long-standing psychiatric difficulties.
From being homesick to depression, anxiety, eating disorders, substance abuse, questioning sexual orientation, identity.
No, I'm pretty non-confrontational, so I don't always feel comfortable.
Relationship issues, academic difficulties. It really is a wide range. I'd say anxiety is probably one of the biggest.
College can be tough. College is tough for most people, but it's important to find ways to cope with challenges in college. And one of Yale's strengths is that it provides a really excellent network of different resources.
You have your FROCO, you have your big SIBs in your college.
The residential college master, the residential college dean.
Your faculty advisor that's assigned to you. You have Walden peer counselors, you have peer liaisons.
In many cases, that's not sufficient. Having professionals in mental health and counseling understand what students go through, and having seen many of these types of students go through similar challenges, make them very, very effective.
There are psychologists and psychiatrists and social workers from different backgrounds.
There are individual therapy options as well as group therapy options. And from a medication perspective, if someone needs to be on medication or if medication is thought to be helpful for their individual case, that's an option that's also provided here.
You'd be very surprised that most students don't actually know what happens in an appointment, or some don't even know how to make an appointment.
The first step is calling mental health and counseling. You'll speak with the receptionist and they'll schedule an initial evaluation within a couple of days or the same day if you communicate that that's important.
Once that initial evaluation is set up, and that can be with any one of us, any psychologist, any psychiatrist, any social worker here, that student will come and have about a 45-minute to an hour appointment.
At that first appointment, after getting connected with a student, there's a discussion about how we'll be setting up treatment going forward.
There is technically a limit on how many sessions you're allowed in a given semester or given year, but they're not just going to cut you off no matter how you're doing.
Definitely a big misconception is that if you've waived the specialty care coverage, you don't get mental health and counseling covered. But you do.
You can talk to someone 24/7 by calling the acute care line and asking for a mental health professional on call.
During the summers, during holidays, someone is always available.
The care that students seek is confidential.
They will not talk to your deans, they won't talk to your parents, they won't talk to your masters. It's just between you and the counselors.
And just being able to hear yourself talk about what's going on and have a therapist reflect on what you're saying is really helpful.
And I hear from students after they've graduated, 4 or 5 years later. It's amazing to sort of see the progress.
Yale's a community, and basically we specialize in this community.